Class, I wanted to go over these questions and answers regarding our exemplar osteoarthritis. They are uploaded in your Canvas course under week 6, but I'd just like to go over them with you as a class. First question is, an obese patient with degenerative joint disease is being managed pharmacologically with aspirin therapy. The nurse determines that additional teaching is needed when the client makes which of the following statements? I'll let you look over the answers for a few seconds. Hopefully you chose the answer of 1. I take my aspirin when I have extreme pain or stiffness. It's really important that if a person knows that they're having this chronic pain, that they take their aspirin continuously to achieve some type of therapeutic blood level. It's not to be taken intermittently. The other statements are appropriate self-care measures when taking aspirin for osteoarthritis. Question 2. The nurse collects data from a patient with suspected osteoarthritis. The nurse elicits information that will confirm which of the following manifestations of osteoarthritis. Give you a few seconds to look at the choices. Hopefully you selected number 2. It's a dull, aching pain in the joints. Dull, aching pain after rest or intensified pain after activity with stiffness is characteristic of osteoarthritis. An elevated SED rate and a positive rheumatoid factor are characteristics of more of rheumatoid arthritis. There are no lab tests that diagnose osteoarthritis. An elevated white blood count is not characteristics of this disease. Remember, that's usually happening when there's some kind of infection occurring. Question 3. A 63-year-old patient has recently been diagnosed with osteoarthritis, and the nurse is teaching the patient about activities to manage the disease. The nurse includes which of the following in the teaching? Give you a few seconds to review these choices. The answer is do not overuse affective joints. Symptoms of joint pain and swelling will increase if the affected joint is overused or stressed. Ice and heat are acceptable for a maximum of 20 minutes. Mild exercise balanced with rest is best for the affected areas. And sometimes even 20 minutes may be too much. Sometimes it's nice to use intervals of about 10 minutes to kind of relieve some of that discomfort. And that concludes the osteoarthritis questions. Class, what I have up here on the screen is just an example of Cecilia Bly. She's one of our characters from the neighborhood, and she represents, I think she's 83 now, who definitely is dealing with osteoarthritis, and I just kind of want to present a picture of how she's presenting with this disease, and just what kind of things she's doing to try to manage it. Cecilia goes to a community health fair with her daughter and granddaughter. At the fair, Cecilia has screenings for osteoporosis, blood pressure, and glucose, and she has her height and weight checked. At one of the stations, Cecilia talks with the nurse about her joint pain. The nurse encourages Cecilia to make an appointment with the healthcare provider to have the symptom evaluated and gives her patient information flyer on osteoarthritis. And after reading the flyer, Cecilia is pretty sure that osteoarthritis is what is causing her pain. Cecilia learns that several over-the-counter medications such as glucosamine, acetaminophen, and ibuprofen are effective for treating arthritic pain, and Cecilia's daughter agrees to pick these medications up from the drugstore for her to try. Cecilia also picks up a flyer on smoking cessation from a table at the health fair. She takes the flyer home and gives it to Jimmy to read. And these are Grandma Cecilia's words of wisdom. Take care of your body, keep your weight as close to normal as possible, exercise often, and eat right. I don't always follow my own advice, and now I have significant joint pain. I'm not complaining, but I wish I had done these things throughout my life. Seek out medical care on a regular basis and then follow the advice you get. Don't ever smoke cigarettes. Don't ever try that first one. If you do find yourself smoking, then quit immediately. Do whatever it takes to quit. Look at Grandpa Jimmy. He is suffering now because of smoking. He won't admit it, but I can see him struggling to breathe. I can see it getting worse and worse. I have also seen him try to quit smoking. I can see that it is hard. I wish he would try harder. He doesn't seem to understand how important it is, maybe because he doesn't want to admit that it is the cause of his problems. And I think if you remember, we talked about Jimmy Bly with his problems with COPD. He's the one that's extremely hard of hearing. So anyways, Cecilia tries to be very active. She spends times in her garden, and she experiences a lot of joint pain in her joint pain. Her daughter helps her by massaging her joints. Cecilia tells her daughter that she is experiencing so much pain that she wants to see a physician to find out if she could benefit from other treatments. Cecilia's daughter calls and makes an appointment for next week. And so Jimmy's daughter and Jimmy accompanies Cecilia to Dr. Rowe's office, where history and exam are done. And from the history, Dr. Rowe learns that Cecilia's primary symptoms are joint pain and joint swelling. He also learns that she's had this joint pain since her early 40s, but it has become more noticeably and progressively worse since her 70s. Her pain is most severe in the knees and hips, often making walking very painful, especially in the early part of the morning. In the past, Cecilia could get relief by resting, but over the past several years, she has experienced pain both with activity and during rest. In fact, she often awakens at night with joint pain. She treats herself with ibuprofen and aspirin, and occasionally she uses a heating pad over her joints and relates that her daughters help by massaging her joints. After an exam, the physician advised Cecilia to have some lab work and x-rays performed. She is scheduled for these tests in the upcoming week. So she does have x-rays done, taken of her knees, her hips, and her spine, and she also goes to the outpatient to have some blood tests done, complete blood count and erythrocyte sedimentation rate. And several days later, she returns to Dr. Rowe's office to get her results. She is told that she has joint space narrowing in her joints, a finding that is consistent with osteoarthritis. She is also told that her blood tests were all normal, and Dr. Rowe tells Cecilia to do what she has already been doing. Basically, she was told to use those over-the-counter medications to treat her condition, acetaminophen, ibuprofen, and glucosamine. Additionally, she is advised to increase the period of rest between activities and to avoid strenuous movement of her knee and her hip joints. Cecilia wonders why she even bothered going to the doctor. So I just wanted to kind of share that with you, and sometimes it can be very frustrating for these patients because there isn't a whole lot we can do about it. I mean, sometimes as this disease gets incredibly more progressive, some people at some point may need maybe a total knee or a total hip. But I think it's just very hard to adapt to the incredible pain that goes along with this because it truly, truly affects the mobility of the individual. And someone like Cecilia, who's been very active, she likes to work in her garden, and she really is kind of the cornerstone of the household because her husband, Jimmy, has so many health problems, especially with his smoking. He's hearingly impaired, and he really does have a lot of respiratory issues because of his smoking and his COPD, that she kind of just gets very frustrated because she cannot do the things that she used to do. So I think it's just a matter of, trying to treat the pain. And I guess the reason that she did go to the doctor was to rule out any other pathologies and just to confirm the fact that she did have osteoarthritis. But for Cecilia, I think she just wanted more out of her doctor than what he could give her. But unfortunately, there really is no treatment that's going to take away all that pain. It really is just, unfortunately, that degeneration of bone disease. So I just kind of wanted to share that with you.
Mobility. And our exemplar here, as we look on the concept of mobility across the lifespan, is our exemplar known as scoliosis. Scoliosis is a lateral curvature of the spine. There are several types of scoliosis, but we'll discuss the type here that occurs in children just prior to and during adolescence. So as you can see from this slide, scoliosis occurs when the spine is pulled to one side or the other. This type of scoliosis occurs during adolescence or just before the growth spurt begins, and the spine can continue to curve until full height is reached and growth is over. This disorder occurs more often in girls than in boys. The type of scoliosis we'll discuss here in this lecture is the form that appears during adolescence, and actually that's the type that's the most common. The diagnosis of this disorder will first be based on a musculoskeletal exam and x-rays that will show the lateral curvature of the spine. Medical management will depend upon the degree of the curve, the age of the child at the time of diagnosis, and the expected amount of future growth for that child. The treatment may consist of exercises to strengthen the back muscles, so collaboration with physical therapy is important. Bracing the spine with different types of devices and consultations and collaborations with orthotics are important there. And the use of a TENS unit to stimulate spinal muscle contraction, again with collaboration with PT, and surgery of the spine if necessary. Severe curves that are uncorrected can lead to respiratory compromise as the rib cage becomes misshapen and twisted, which doesn't allow for adequate air exchange. In our nursing assessment for a child with possible scoliosis, screenings may take place in school. Although many adolescents may have less than perfect posture, some may have what is called a functional scoliosis from carrying heavy backpacks over one shoulder. This scoliosis is temporary and should disappear when the child is asked to stand up straight. The nurse should be aware of such findings such as uneven shoulder height, uneven scapulae and back, and uneven hips when facing the child. Another indication that scoliosis may be present is observing the child when they are facing away from you and bent over at the waist. In this position, you may see an asymmetry of the back, which can be described as a hump on one side. This occurs with curving of the spine. So these children are at risk for immobility. The main goals of nursing care are preserving tissue integrity, keeping the patient safe from injury, particularly when wearing the brace, encouraging compliance with the treatment plan, and education for both the patient and the family. It can be challenging for children of this developmental level to wear the prescribed brace because they are concerned with looking like and being like their peers. On this slide, there are more interventions in order to reach the above noted goals. And here I have listed the evaluation criteria for our nursing care for a child with scoliosis. And that will conclude this short lecture on scoliosis.
I wanted to present to you this little video that Dr. Joris made for us. Her specialty is pediatrics, and she's dealt with many of these children who have shown signs of scoliosis. She has also served as a school nurse and has done a lot of these screenings for scoliosis. It seems quite appropriate to discuss scoliosis because it can lead to problems of immobility. As she stated in the video, scoliosis can be a lateral, sideways, or curvature of the spine, and we may see it either presented as a C-shaped or an S-shaped type of scoliosis. And we can also classify whether or not a person has mild, which would show a 10 to 20 degree curvature, a moderate type of scoliosis, which could show a 20 to 40 degree curvature, or a severe type of scoliosis, which would be more than a 40 degree curvature. It can be either classified as structural or non-structural. Non-structural occurs as the spine bends to compensate for poor posture, differs in length, leg length. Presence of tumors can cause this, adaptation to pain or other physical conditions. Actually, this can be fixed by alleviating the underlying cause. Structural scoliosis is much more severe. It can involve deformities of the bones in the spine. Sometimes scoliosis can be idiopathic, which there is unknown etiology. That presents in about 80 to 85% of the people diagnosed with scoliosis. Sometimes children can be born with it, called congenital scoliosis. And along with the scoliosis problem, many can also have heart and kidney problems. The most common curve pattern is a right thoracic curve. And sometimes we might see a right hump, ribs move closer together. Risk factors for someone to develop scoliosis would be in that adolescent stage where these children start to have growth spurts between the ages of 9 and 15. Girls, as Dr. Joris said, are more likely. Sometimes we see it with neuromuscular disorders such as cerebral palsy, muscular dystrophy, and things like that. How do we diagnose it? Definitely school screenings have caught a lot of these kids with scoliosis. X-rays, they might also do MRIs, CTs, bone scans, things like that to kind of verify that the person does have scoliosis. Because of some of the pain that may be involved, NSAIDs may be a way to relieve that pain. For some of the severe pain, sometimes opiates. Non-pharmacological interventions depend on the severity. Sometimes, as Dr. Joris said, a brace may be a great intervention to help these kids with some of the pain and also the compromise of their respiratory status. And when it's extreme, many times surgery is probably the only alternative to fixing the problem. And being an ICU nurse, I took care of a lot of these kids that would come in for a Harrington rod placed in their spine to kind of straighten that spine, and they would be in ICU overnight just to assess very frequently their neurological status and look for any signs of infection or hemorrhage. And they would be what we called putting them on a striker frame, where we would flip them over to be able to look at that incision and tell them to lay extremely still, but at the same time we would be assessing their neurostatus to make sure there wasn't any impairment or any compromise within their spinal cord. So I just wanted to kind of go over that with you because I think scoliosis does represent another type of problem that we may see that will affect mobility. And I'm sure from your reading you could gather that, you know, we've kind of referred to many of the bones in regards to immobility, but don't forget about the physiological way in which we move. Not only is bones involved, but our muscles, joints, tendons, ligaments, and cartilage. Yes, our bone is the framework, but there's joints between those bones. And then we also have tendons, ligaments, and cartilage, and these connect bones with either muscle or other bones and provide a cushioning during movements, okay? So I want you to realize that sometimes we see people have issues with muscle, where they might have a strain of a muscle, and that may interfere with mobility. We know people have a tear or a strain in their ligaments, tendons, cartilage. We know that people suffer from sprains and strains on these particular other structures that keeps those bones intact. Think about too, if we look at the lifespan of an individual, Infant's spine at birth is more C-shaped. They can hold their head up. It's more of a concave curve. The S shape takes about 1 year to complete. We see people that have mobility problems due to the fact that we've seen some of the elderly people develop these shapes of their spine called kyphosis or lordosis, where the kyphosis is more of a convex curvature and the lordosis is more of a concave curvature. Remember, muscle's almost completely formed at birth, and your skeletal muscle is at about 25% of your body weight as children, and then in adulthood it's about 40 to 50% of your body weight. In boys and girls between the ages of 13 and 14, equal amount of muscle. Okay, so I just wanted to go over some of those highlights because I think, you know, we need to look at all structures and aspects that make up our bones that can cause problems with injuries, and definitely will affect the concept of mobility. So I hope this kind of helps, because this is what we normally would have talked about in regards to the concept of mobility and the exemplars. So if you have any questions, I hope you enjoy reviewing these 2 little videos that give you just an idea of what we missed, but hopefully you had a wonderful Thanksgiving. Thank you for your attention, and have a great day.